So as we are all aware, coronavirus has been in the news a lot. Pretty hard to, if you're seeing the news this weekend, to not see a lot of it. Today we had a meeting with a lot of our local elected bodies, including the school districts, fire districts, townships, et cetera, at the police station. Last night I took part in a call with 150 mayors, roughly, a regional call that was spearheaded by the city of Chicago, because they've been on ground zero since the beginning, because they were one of 7 major cities that have flights coming in and out of China. So they've been involved with this since late December. And I just want to give everyone an update, because I think it's really important to give people the information that we have, as opposed to believing what you see on Facebook and what you're seeing, quite frankly, no offense to our reporters down here, but what we're seeing on the news media on TV, because essentially some of them are running it for 8 hours straight because they want viewership. So basically, if it, as George says, if it bleeds, it leads. So therefore, they keep putting it out there. So I wanted to get the facts out for you. The history of the coronavirus, and first off, coronavirus has been around since the mid-60s, and that's the common cold, but it also is SARS and MERS, so it has a lot of strains, just like the flu. In late December, coronavirus emerged in China. There were unprecedented quarantine efforts that were taken to keep it quarantined. Those did not work. Cases continued to emerge in other locations. Locally, 3 cases have been identified. The history of this is essentially that last week the CDC expressed a bit more concern because there's more worldwide spread in spite of the quarantine efforts, because they recognize the quarantine efforts did not work. There's 60 countries with infections. They're on every continent except Antarctica. Recent developments in the last 48 hours. There was the first death in the US. There were 2 as of last night, and I guess we had 4 more today, which I'll talk about here briefly. The first healthcare worker was infected last weekend. The first infection in a long-term care facility occurred last weekend, and that's, I believe, where the 4 deaths occurred. So they were very ill people to begin with. It was also the first, we've also this weekend had the first community spread, which means it was the first person that wasn't directly involved in a flight or in contact with someone, at least that we're aware of. So all of these things happened on the West Coast. As we know, there's a suburban Cook County resident became the 3rd person in the Chicagoland area. And last night we had the head of Chicago Public Health on there, who's been in touch with the CDC. So this information is very recent. The way they look at any type of issue like this, like the flu or anything that could become a pandemic, and flu is the one that we really worry about becoming a pandemic, and it does from time to time. There's 2 things: severity and spread. On both of those fronts, it's good news. The severity of this case, 80% of the cases are mild with no hospitalization. They essentially present themselves as a common cold. Children have proven to be much less likely to be infected. Not unlike the flu, older and people who are immunocompromised are the people who are most likely to have severe infections. The mortality rate is 1% to 2%. They believe, the CDC believes, that's going to trend down towards about 1% as they get better at identifying it and better at some of the treatment options that are out there. So, and that's not anything to sneeze at, that's 1 in 100. But to put it in perspective, SARS is 1 person in 10, MERS is 1 person in 3. The flu, the most virulent forms of the flu are about 1 in 500. So while it has a mortality rate, it is very, very low. The spread is also good news. Put it in perspective, measles, which is a fairly virulent spreading disease, 1 person will affect 18 on average. In this case, it's 1 person infects 2 to 3. So it's spreading at a much, much slower pace. So those are 2 things that make the CDC very happy. And when they plan, they look to slow the spread and minimize the mortality. Those are the first 2 things. The next 2 things they look to do is they look to preserve the healthcare system, and they look to limit the impact on the economy. So preserving the healthcare system, that means taking care of yourself for the flu and everything else so that it's not inundated with flu cases if these cases do show up. So they don't want the healthcare system to be overrun by this because of other diseases or because of panic or other things. Also limiting the impact on the economy. I mean, what we're seeing and hearing about with Costco being out of toilet paper and things, people are kind of, they're taking this to a new proportion, which they don't need to. And it's very important to know that go about your daily lives. The big thing on public awareness is remain calm about this, go about your daily life. We're prepared. All of these mayors were in this conference because we're prepared, not because we're afraid of what's coming, but because we're ahead of it, we're talking about it, okay? We're coordinating with one another. We're not in a vacuum. The fire protection was there today, the police department, our police department was there today, all the school districts were there, the townships were there. Other neighboring mayors of smaller communities, which we know they don't have the resources we do, they were there. Chicago did that for us yesterday. They know we don't have all the resources and we're not on the front line. They're making sure we have all this. So we are coordinating. And we're being transparent. We're telling you what's going on. I just gave you all of the facts that we have, and we will continue to update that. But we want to make sure that we're combating the misinformation that's out there and convey to you the facts. So to reiterate, the risk is very low. Go about your daily lives, okay? What you can do to avoid this: wash your hands, cover your mouth when you sneeze or cough. If you're sick, stay home from work, stay home from school. Simple things. If you're elderly and you get these symptoms, go to the doctor right away. If you're already sick and you feel like you're getting sicker, go to the doctor right away. Avoid touching your eyes and nose and mouth with unwashed hands. So those are the simple things that you can do. Wash your hands. Use it, if that's not there, use a disinfect. Use hand sanitizer. All of those things. And also, if you have any questions, we'll have information on the website, on our website. We also have an email set up. If you have any questions, we'll be happy to answer them for you. It's coronavirusinfo@orlandpark.org. You can call our main line, 708-403-6100, and then you can ask for, there'll be a prompt for coronavirus, I believe, and it'll go directly to someone to answer that. Is that correct, George? Or we'll just go to the main switchboard and they'll know okay, they'll go to the main switchboard and they'll direct you to the right location. Also, www.chicago.gov/coronavirus. They have regular updates from the World Health Organization and the CDC. They're putting all that information out there. The most important thing we can do here is to use common sense, go about your daily lives. This is very similar to the flu. That's what we've got going on here. And to keep in mind, there's still, I believe, less than 100 cases in the U.S. So that we know about. So it's still very, very small, very contained. But it's likely, we're not going to hide anything from you. You're going to see more cases because the quarantine didn't work. So you will see some more cases. That's just going to happen. But if you go about your daily lives, if you're not otherwise sick and you're not elderly, there's nothing to be concerned about. If you are sick or elderly, it's like the flu. You need to pay attention to it. And if you haven't gotten your flu shot already, go get your flu shot so you don't end up in the hospital for the flu that could potentially be used to help other people. You don't need masks. There's no special equipment. You're not going to see people in big hazmat suits or any of that kind of stuff because the standard protection for first responders is just a mask, is it. And if you don't wear a mask unless you're infected, because it doesn't help. So if you're infected, they'll tell you to wear a mask because they don't want you coughing or sneezing on other people. So those are the facts. It's really important that we get those out to you. We will keep those updated on a regular basis on the Village of Orland Park website.